Well, another fascinating thing I found was this fMRI predicting the success in treatment. I mean, I find very often fMRI is used a little bit because you want to add some pictures, but it doesn't really tell very much. So patient has recovered and then surprise, surprise, there is some change on the fMRI. Well, if the patient has recovered, then we know it anyway. Now here is of course fascinating because here in a way the fMRI can tell you whether this would be a good candidate or not. Do you think this will kind of become more used, I mean, particularly if there are only very limited resources, to concentrate treatment on those patients who will benefit?
Yes, I think so. Functional MRI, in this study has been done in Germany by Richter, and they use a naming paradigm of the patient during the functional MRI, name different pictures, and they evaluate the activity of the contralateral hemisphere. At present, there is some controversy about the role of the right hemisphere in language recovery. Some researchers think that the activity in the right hemisphere is maladaptive, whereas others, including me, think that the activity on the right hemisphere can help the patients. For instance, the recovery of patients with major stroke in the left hemisphere, with massive damage to the perisylvian area, only have the possibility to recover at the expense of the right hemisphere, because there are no preserved tissue or eloquent tissue in the left hemisphere. I think that functional MRI or perhaps transcranial Doppler or some cheaper techniques may be useful in the future to predict the evolution of the patient. The clinical symptoms are also important. In our experience, patients who have severe global aphasia are not good candidates to be treated with drugs, except that you use tailor-made speech-language therapy combined with drugs. We have the recent experience of a patient who had a severe global aphasia. This patient participated in several drug trials with us, but she didn't show any recovery. When evaluated several years after her participation in a drug trial, the last summer, we administered her the Western aphasia battery, and to my surprise, she spontaneously improved the ability to repeat language. It was really amazing, 8 years after onset. Therefore, we implemented a very specific strategy for this patient that was audiovisual feedback. The patient saw a video, tried to imitate, look the mouth of the speaker, and try to imitate the intonation and also the tone to repeat the sentences. And she not only improved her repetition, but also translate some gains to her everyday spontaneous speech. Of course, this is only a single case, it's an anecdote, but there are other techniques that we can use to treat patients with global aphasia. Some people from Boston, Goffrey Slough, have shown if you use melodic intonation therapy with rhythm, with tapping, some patients not only improve speech fluency, but also increase the volume of the right arcuate fasciculus, that is the white matter tracts that connect the posterior with anterior areas, so that these patients should not be abandoned for the treatment, despite that they may have several years of evolution of aphasia.